Well, thank you, George, for joining us this morning and for all your service to the ASDS. When you look back, what do you think the most memorable experience was for you when you were serving as president?
We had a real dilemma, which consisted of who was going to manage it and send out the dues, collect the dues, do all the paperwork, secretary work, because none of the people who wanted to be president at that time, I think I was number 8 or number 9 in the presidential list, and so they all wanted to be president, but they didn't want to do the work, and we had a secretary who didn't want to do the work. So I had a crisis to find out who would do the management. And I think you've heard others speak about arrangements with the American Academy of Dermatology. That solved several bad wounds. Jealousy and competition between the new upstart American Society for Dermatologic Surgery, which was then in its 9th year, had an ever-increasing membership, and Dr. James Burks, who was a long-time stalwart member and on, you might say, the inside connection with the American Academy of Dermatology. He had just died in '77, and he made me promise 2 things. One, make sure you maintain good relations with the American Academy of Dermatology, because they have the history since 1932. They have all of the qualifications for continuing medical education as they're coming on board, and they have a management division which will help you. And whatever you do, don't let regular dermatology fall behind, and make sure you know your dermatopathology, because you don't want to go to just doing superficial cosmetic procedures but not know your dermatology. And he said that should be a hallmark, and that's the position I took.
That's great. With a lot of issues going on, it seems, at that time.
Well, others have mentioned that cosmetic surgery was being attacked as the only ones qualified were board-certified plastic surgeons. Their big mistake was they discarded the unboard certified or non-board certified, who actually became internal enemies. And so I helped found a new organization called the American Academy of Cosmetic Surgery, which I incorporated in Louisiana, and it emerged with another competitor, and then later, in essence, merged with the Facial Plastic Organization. And that was for 2 purposes. One, to keep dermatologic surgery acceptable to other surgical specialties, and to keep it from being swept under the rug. And in 9 states, the Medical License Board had attacked viciously various dermatologists, including one who was the chairman at Duke University, Dr. Lamar Calloway, Dr. James Trimble in Florida. They kind of destroyed them. And they attacked Dr. Burks. I got him out of it, luckily, by a stroke of luck. And but we had to defend ourselves. And so the best way is to find an ally. It's like the United States now has NATO, and that's about it. But maybe things will happen as those things change. But to me, that was very, very important, and it was not necessarily competition for who was going to be president. That was big, but it was for 1 year. So one of the things I did with an Obama technique back then was to use executive authority of the presidency to make sure all presidents who were president for 1 year, the experience and what they learned should not go to waste. There should be a continuity. So I got put into the bylaws that the presidents would serve 4 years on the board of directors and were the nominating committee. So you always had 4 people with experience. And that continuity was very important. And the next thing was to find individuals, to identify them as to who could be future leaders. Otherwise, the minute they passed the gavel, like happened today, the previous president, when they came in this morning, everybody walked up and shook her hand and thanked her for everything. But after she passed the gavel, they walked right by her looking for the new president.
Well, I think it's so important to have that institutional memory in any organization, and particularly something like this.
To keep what you have good and look for new leaders. And that is probably the hallmark of what I feel most comfortable with, is that the group that started were able to pinpoint certain future leaders. Probably the most successful of them was Bill Coleman, but he also continued as editor of the journal and has done a fantastic job. And that's what you need to be able to get your own continuing medical education credits. There were other leaders who were on a list that no one published, and that included one of your previous speakers today, Dr. Mandy, and several other people, Dr. McBurney, and people that would help, and Dr. Coleman had great influence on that. He served 1 year like everybody else, but he kept a continuing interest, which was what you need for an otherwise private organization.
Yeah, and I think one of the things we've just implemented in the last couple of years is to tap into the expertise and experience of our past presidents. We have the past presidents think tank, because these are people who led the organization for that year and probably many years around it. And then, like you said, sometimes, get passed over. So it's so important, I think, for us as a society, bring them back in, keep their energy, keep their ideas going. And we're learning, a great deal from them. So thank you for that. Now, you were president in 1979, 1980. Do you remember what the most significant innovations or what was going on in dermatology at that time?
Finding a new executive management team that could get us continuing medical education credentials.
Well, how about like procedures? What procedures were dermatologic surgeons doing then?
Well, I played a big role in the administration of how things went and the development, and it goes back to before I got out of the Air Force. I found some other dermatologists who had similar ideas, and we started that in 1964, and it just came to fruition in 1970. Okay, well, one of the things that were most popular at that time were hair transplant, dermabrasion, liposuction, which has just been brought to the United States by Dr. Larry Fields vis-a-vis Giorgio Fischer in Italy, and a couple of other doctors. And that's been big. In fact, one of our long-term major supporters of this organization, Dr. Coleman, he became very adept at it, and that's been a big part of his practice. But the new thing that came up at that time was the pitfalls of using phenolic peels, because it could produce toxicity, which could be real bad if they had some underlying other hepatic disease. And to educate people and to tell them how easy it was and how safe it was to use trichloroacetic acid peels and how to do it. So that was first published in 1979 by myself and Dr. Birx. He actually wasn't alive at the time, but he was my mentor. And FYI, you cannot be allergic to trichloroacetic acid. It's part of your Krebs cycle. And it is not available on its own. It has to be mixed with something like water or something else. It causes, depending on the strength, causes immediate destruction of only the keratotic layer. Safe. The healing takes 5 days, and people look great. I tried to dispel the dangerous phenolic peel, which I successfully did. And as one of your previous interviewees today said, there was a big problem with the plastic surgeons. They didn't know kiwi from shinola about TCA peels, and they only knew about one plastic surgeon from the Miami area, at least part-time, which was called Baker's Formula. And that used crotonol, which is the basis for which sarin gas is made. And sarin gas is now a World Health Organization crime. And so if you talk about something big, if you don't know what went behind it, you don't know if it's big or not. But that was one of the things to dispel, and effectively worked.
Yeah, TCA peels work beautifully. I always, in my lectures I give for lasers and resurfacing in these, $150,000 machines, I always show a before and after of some of my patients with 25 cents worth of TCA, and it looks just as impressive often. And you've seen a lot of patients over the years. Do you have any patients that particularly stick out to you as being very memorable?
I had a very large practice with 8 clinics, and I eventually saw every patient with a serious problem. And I could probably list 100, but there's one that stands out. A lady who worked for Tulane Hospital. She had lupus erythematosus, the discoid variety, and she had horrible scars on her scalp. The primary area of involvement on her was her scalp, and she had to wear wigs, and she worked for Tulane because they understood and would give her a job. So I, for free, had her come to my office, which I had opened a new surgery center in where the airport is in New Orleans called Kenner, and brought her in, and I did hair transplants from her own scalp into the lupus areas in a technique that they all survived. And after a year and about 7 or 8 procedures, she was the happiest person I've ever met in my life. Her life was changed.
What a gift.
Yeah.
And looking back at your career, is there anything you would have done differently?
Well, I was a career military first, and I got every kind of award you could get, and I was in Vietnam, the first dermatologist ever in Vietnam, and I first diagnosed 3 epidemics there, one of syphilis, one of bubonic plague, being a dermatologist, and they all had cutaneous manifestations, and the one that just came up big in the past 2 years is Zika. They called it dengue fever over there, but it's the same virus, slightly different morphological pattern, but the same antigenicity factors or antibodies that they develop. And I stopped that epidemic cold and got a Bronze Star for that. But now people don't understand that Zika is the same thing. It's an easy treatment, easy to diagnose. And I have a new profession as a medical detective, and I contacted various health organizations, tell them, you don't need $1.8 billion, which they fought in Congress for. All you have to do is a simple gram stain, and you can find what dermatologists know as a zinc stain or a zinc smear. It's basically the same thing as a gram stain, just add a little dye to it. But you can do it in your office for $1. And so anybody suspected of having it, if they get the rash form, they're more likely than not to see a dermatologist. So I think dermatologists ought to be aware of this, because if somebody comes in with an erythema multiforme type reaction, if they have fever, all they have to do is, they don't have to do a biopsy. You can, but you do a zinc smear just like doing for herpes simplex.
Well, that's great. Today's Veterans Day, so we thank you for your service. Worked out perfectly. What advice would you give to today's young dermatologic surgeons?
I think that is probably the most poignant question you've asked. And my advice would be to get more familiar with whatever replaces the federal program, otherwise known as Obamacare. Learn what it is and try to work within the system instead of just trying to find some easy, non-cutting procedures that use the skin, and they call themselves dermatologic surgeons, but they really don't do surgery. If they want to do surgery, then according to the American Board of Cosmetic Surgery, dermatologists are included, but after the first few years of grandfathering in, they now require you to take 1 year of general surgery in order to be qualified to be a member and to get board certified. And only about 20 dermatologists have ever been board certified with that group, but they have their own board. So if somebody has a career where they like surgical procedures, they should do that. They can actually do that concurrently 1 year with a dermatology residency in some places, or do a 4th year. If they want to do surgery, if they want to do medical dermatology, there's a big need for that, because dermatology is the window of disease for your whole body. And too many dermatologists quickly forget all the physical examination parts, which is the most important thing. See the patient, make your quick cutaneous diagnoses, do a good history and physical, get appropriate lab work, and then you start on whatever you want to do in dermatology. First, be an expert.
That's a good advice. What are your predictions for the future of our specialty?
I think dermatology is going to be overwhelmed because of so many new types of medications that are being evolved, and there are so many other kinds of medications that you don't actually see it in the form of an erythematous rash, but there are many other significant features that you can, a dermatologist who's trained to diagnose by looking at the skin. It's also the only thing other than cardiology that you can get telemed for and get covered by Medicare, because you can take a picture on the skin. And in cardiology, you be in northern Maine on the border with Canada, have a patient in no hospital, and you can send EKG, scan it, and send it to a doctor like in Tulane on the other side of the country. A cardiologist can look at it, send you back the information, you know what to do. You can do that in skin too. That's about it. So I think that's an innovation, and with all the new diseases that are coming up, and I'll give you a perfect example. MH370, plane went down, a Boeing 770 went down, and they couldn't figure out who did it and why they did it. But if you look at the pictures that they revealed, as a dermatologist, you could tell right off the bat that the man had asymmetry of the face. He had the sword-like lesion on the scalp that you see as a sign of, used to be called scleroderma, but has nothing to do with that. You do develop a unilateral sclerodermoid aspect. But it simply means that there was either intrauterine brain damage on the opposite side or early age in the first 2 years of brain damage. And these people develop premature Alzheimer's disease, whereas the normal span of growth mentally of any human is to age 25, and then it's downhill. But in people with un coup de sabre, which is the French name for the sword injury, they start going downhill and develop early Alzheimer's much more frequently. And people with facial asymmetry do the same thing. And you see early onset of Parkinsonism and early onset of several other types of neurologic disorders. And the dermatologists can see this when they come in at age 5. But most patients that have these asymmetries hide them with makeup. Like if you were a gynecologist and a patient walked in, a female patient walked in and one breast was larger than the other breast, they have ways to hide that. But if you look at them closely, you'll see there may be not a hemiatrophy, but a hemiasymmetry. And you can make the diagnosis. And the whole point with all of that is that observation and sticking to what you learned in residency about diagnosis is the most important thing you can tell a dermatology resident. Don't go off on a tangent about things you won't be able to do right off the bat, like dermatologic surgery. Learn that, get real skilled at it, and then adapt to dermatologic surgery.
It's good advice. What advice do you have for the leadership of the ASDS going forward?
I was very impressed with the current issue of Currents, the December issue, where I think the outgoing president, Naomi Lawrence, had a one-page article where she outlined what's going to be necessary and what's necessary now. And I refer you or to anybody else to read that, because that is the format for the next 5 to 10 years. And that includes new ideas, as you inquired, and it includes what to do about it and setting up task force. I think the one thing that I would recommend for this society to do immediately, and the new incoming president can implement it by executive action. And that is to form a task force or committee to review any and all information that comes out of the newly elected President of the United States that is going to replace Obamacare. Get our society up to date and keep up to date. And people need a certain knowledge other than dermatology to do that, but we have those members. And they can do it and stay up to date. And then make sure that all of the membership gets to know that. And then for the still fretting American Academy of Dermatology, sell them or look for influence or valuable considerations what you learn.
All right, George. Well, thank you very much. It was a pleasure.
Thank you.